Good morning. Today we're going to demonstrate a routine skull. The projections for the routine skull are an AP axial or Townes method, PA axial or Caldwell method, and then a right and left lateral. So 4 images altogether. We're going to start first by cleaning the board prior to starting the procedure. You always want to make sure that your patient sees you cleaning the board. That way they know it's clean. You always use gloves when using the wipes as well. Okay, board is clean. I'm going to now get my image receptor. We're going to use a 10 by 12 lengthwise for portrait in the bucky. I'm going to place the left marker. The patient's left side is going to be closest to me, so we're going to use that. Okay. Patient will now come in. You'll slide them in, and they're going to put their back right up against the board. The first image, like I said, we're going to do is the AP Townes or the AP axial, the Townes method. We're going to angle our tube 30 degrees caudad. So we're going to start with it at 90, and then we're going to go 30 degrees down, which will take it to 60. Collimators are 10 by 12 lengthwise. We're going to position the patient's head so that their back is up against the board and their chin is tucked. You want your OML perpendicular to the image receptor. The central ray is going to exit about 3 inches above the glabella or the patient's hairline. Then we need to make sure the patient is in the middle and centered up. Good. We're going to now center our bucky tray. Always make sure you tell your patient you're going to move the board in case their back is there. You don't want to hit their back. There's our AP Townes. Chin tucked, OML perpendicular, 30 degrees caudad. The next image we're going to take is the PA axial or the Caldwell method. We're going to switch out our image receptor. The patient's going to be PA against the board this time, so our marker also needs to change. We're going to put the right marker on there. Patient's now going to put their nose and forehead on the board. The central ray is going to enter at the exit at the nasion. We're going to angle 15 degrees caudad. So if you go off of the 90, it's going to be at 75. I always like to make sure when you see to go to the nasion, you put this line on the board right at the nasion. So I'll come around this way to check if it's there. And yes, it is. Patient's head is straight. Come behind them to make sure it's straight. Don't assume it is. And then I'm going to center up the bucky. And it is centered. You can see that it's centered to the image receptor. There is our PA axial or Caldwell method. The next image we're going to take is our lateral skull. For the lateral skull, you need to put your image receptor in crosswise or landscape. So you need to switch the holder. Technical difficulty. Your center ray is going to be straight. You need to adjust your collimators to crosswise as well. All right, patient's going to be facing the board, almost a little bit oblique, and their head is going to be right against the board, like so. This would be our left lateral, so I will put a left marker on the image receptor. For this, your center ray is going to enter 2 inches of superior to the EAM. So right above your EAM, your external auditory meatus, the opening in your ear. Again, you want to get down and make sure the patient is straight. There's no rotation or tilt. You want to make sure that the back of the head is on. There we go. I'm going to center up my bucky. There is your left lateral skull. Next, have the patient lean off the board. Kind of loud sometimes if you're switching your image receptor with their head against the board. We are now going to do the right lateral. I'm going to put the right marker on there before placing it in the bucky. Patient will now put the right side of the head against the board. And again, 2 inches superior to the EAM. Come through to make sure my patient is straight because she's not. She's rotated a little slightly. And there is our right lateral skull. The other thing you want to make sure prior to starting your procedure is to take off all jewelry earrings, necklaces, anything like that also prior to starting the skull.